CHS is enhancing care delivery using an innovative logistics software that reduces wait time in the emergency department and improves coordination while increasing communication. Today we'll see how Good Samaritan Hospital Medical Center continues to advance patient care quality and experience. To learn more, watch this episode of CHS Presents Dr. O, Faithfully Transforming Healthcare. Hello, I'm Dr. Patrick O'Shaughnessy, Executive Vice President and Chief Clinical Officer for Catholic Health Services. Thank you for joining us for today's episode of CHS Presents Dr. O, Faithfully Transforming Healthcare. Catholic Health Services is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, and a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years with comfort, grace, and dignity. CHS is focused on quality, and through this show and many community health initiatives, we promote good health and provide you access to the care you may need. We met up with Dr. Christopher Rayo, CHS's Chairman of Emergency Medicine and also Chairman of Emergency Medicine here at Good Samaritan Hospital, to talk about door-to-floor placement. Take a look. Hi, Dr. Rayo. Thanks for joining us again.
Thanks for having me.
It's great having you here. And we're actually here in Good Samaritan Hospital's emergency department waiting room. And as you can see, the room is pretty much empty. So a lot of great work being done by the hospital, the emergency room, to move patients through the system quicker, meaning getting them out of the waiting room, getting them in the ED, getting them through the ED, and then getting them to their final destination. Can you share a little bit with our viewers at home about the great work being done to improve what is called ED door-to-floor performance?
Sure. So door-to-floor is basically the time from when a patient hits the door of the emergency department to when they're in their bed up on the floor for an admitted patient. And really we've partnered with a company called Care Logistics to develop an air traffic control center where we're following every single step in a patient's progression of care, and we're really able to eliminate any inefficiencies to make that process much smoother, much quicker, and really getting the care to the patient as quickly as possible, which is ultimately our goal.
Some of the things that you've done in terms of building in time point performance metrics in the EMR, our electronic medical records, so that everybody knows the time points to get through a specific testing algorithm, so everybody knows what's going on. Is that accurate?
Absolutely, and as you can see here in the emergency department, we're very, very focused on that, and we're doing every sort of innovative process to get the patients in to see the doctor as quickly as possible, and we're actually doing a very, very good job.
You know, it might be helpful if our viewers get a peek at your tracking board so they could really see how everybody is moved through the system. Would you like to show us that?
Absolutely. Let's go take a look.
Okay, great. Let's go take a look. So here we are in the actual emergency room at Good Samaritan Hospital, and wanted to give folks at home a sense of, again, the great work being done to improve door-to-floor times. And we're actually at our tracking board.
Sure. Right? So the tracking board, as you can see, basically lets us monitor each patient and each step that they have to complete before they can actually leave the ED and go to the floor if they're an admitted patient, or go home if they're discharged. So it really carries us through everything that needs to be done in terms of testing, imaging, and then the eventual transport up to the floor. It really eliminates all those gaps where we're sort of guessing when we can move the patient to the next step in the process.
That's great. So eliminating a lot of the waste getting them through the system quicker and getting them out of the ED quicker.
Correct.
Do you think patients are benefiting from this?
Absolutely, because now we have a lot more information at our fingertips, and we know exactly what's going to happen next for that patient, so the patient experience is much better, and they're actually receiving their care in a more timely fashion.
So quality care has always been exceptional here at Good Samaritan, but now the efficiency of care is getting better and better situational awareness. So everybody knows where the patient is in the system, which cuts down the amount of time that they actually have to spend here in the ED. Fair?
Very fair. And, you know, this is an emergency department where we see close to 90,000 patients a year. So we can see upwards of 250, 280 patients a day. So all these little inefficiencies that we're eliminating are actually allowing us to get to patients quicker and provide better care.
So last question, what would you tell folks in the community who may have not had the best patient experience in the ED, say a year and a half ago, relative to today?
I mean, I think this is a very different place. I think we've made great strides, and we're continuing to improve, we're doing the best job possible that we can for our patients, and I think their patient experience is going to be much improved.
I agree. Thank you and the whole team for the great care you provide here. Thank you for speaking with us today, Dr. Rayo. We'll be right back to discuss more about how to better serve patients by further improving the coordination of care.
We women sure know a lot of numbers by heart. But do you know the most critical numbers for your heart health? That knowledge could save your life. Do you know your numbers? Talk to your healthcare provider today to learn your health numbers. Your heart depends on it.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay? Just go to the site.
Welcome back to CHS Presents Dr. O, Faithfully Transforming Healthcare. Care Logistics at Good Samaritan Medical Center is using a new clinical technology software that monitors the status of patients from the time they are registered at the hospital through the scheduling of tests and treatments to the time they are discharged. To speak more about this is Gara Edelstein, Senior Vice President of Patient Care Services, Chief Nursing Officer, Good Samaritan Hospital Medical Center. Welcome, Gara.
Thank you for having me.
Oh, it's great having you here with us. So maybe you could share with our viewers a little bit about why you felt we needed to roll out this new program at Good Samaritan and really improve throughput, or what we're calling door-to-floor times for our patients.
Okay, so for quite some time, what we noticed here at Good Samaritan Hospital is that although the clinical care is excellent, what we found was happening was that because we had so many patients who come through our doors in the emergency department, we were having trouble moving them through the system. Everybody was working really hard, but we really weren't working together. So what was happening was we found that patients were having increased wait times in the emergency department, and actually increased wait times up on the units, and we needed to come up with some type of a process where we could really streamline that for the patient.
A perfect segue into the next question. So a lot of this is process redesign, right? So
correct.
What did you and the team at Good Samaritan do to change some of the processes here so that you could streamline flow?
So what we realized was we needed technology to help us, but you can't put old processes into new technology. It really doesn't work. So what we did was we said, okay, how can we break down those silos? How can we move and pull everybody together and really create that flow? So really what we did, and a couple of the main process changes we did, were we created something called a SNAP huddle, Status Now Action Planning. And we pulled everybody together, so every single morning here at Good Samaritan, on every single patient unit, we have a SNAP huddle. Who comes together there are the manager, the nurse manager, the managers of care coordination, formerly known as care managers, social workers, physical therapists, anybody that is the physicians that are on the unit that come to see their patient. Anybody who's involved with that patient comes to that SNAP huddle every morning and says, what's the plan for the day? How long is this patient expected to stay here, and what do we need to get done so that this patient can get the treatment that they need and then move on to the next level of care, whether that's home or a skilled nursing facility, etc. So the main way we changed the process was to create two roles. One is a care management role that we converted to a manager of care coordination, because what we found were that care managers, who do a fabulous job, were working Monday through Friday, basically 9 to 5 or 8 to 4,
Right.
and they would set up all these plans for the patient, and then they would need to meet with the family, whatever, but now the family comes at 7 o'clock at night, there's nobody there to really sit down with the patient and talk to them about their care. So the care manager would come back the next morning, and what would happen is that plan would still be in effect. Patient hasn't left. There's a lot of frustration on the part of the patient and the family. So the manager of care coordination, who actually does just that, is here now 24 hours a day, 7 days a week. This way they can meet with the physicians anytime the physicians come in. They can meet with the families, with the patients, whenever it's convenient for the patient for them to meet with them.
See, it's really important because, hospital operations cannot be a Monday to Friday,
That's
9 to 5,
absolutely,
right? So I think you
absolutely.
guys have done a lot of people re-engineering
Correct.
and then process change to say, well, you know what, we're going to do this 24/7, 7 days a week.
Exactly. The other process change we made is somebody called an order organizer. And with that person, if you go into a typical hospital, you have schedulers who are scheduling your CAT scan, somebody else is scheduling your MRI, somebody else might be scheduling your cardiac cath or your OR procedure. So what we did there was we pulled that group together and we said, let's coordinate all that testing so that you as a patient don't have to come into the hospital, go down for your test at 9 o'clock for your CAT scan, you come back up, 2 hours later you're going back down for something else, another test. It's frustrating for the patient, it's frustrating for the staff. This way, what the order organizer does is pulls all that together and schedules it conveniently for the patient. And it makes it much, much easier for that patient so that it's one shot, they get on the stretcher, they go down to radiology, they get all their tests, and then they come back upstairs to their room.
So it's interesting, we talked about this before, kind of rebranding this. It's really the mnemonic of air traffic control. You guys call it care traffic control, which
That's
I think
right.
is really impressive. Any barriers? I mean, this is a lot of work in terms of re-engineering people, process redesign. What were some of the barriers you faced and things that you had to kind of push through to get to the new state at Good Samaritan, which, as you can see, your length of stay has dropped,
Correct.
your emergency room dwell times are lower,
Right,
your patient
right,
satisfaction
right.
scores are improving.
I think what we had to do, the challenge is always reminding everybody that we have to keep the patient at the center. And what's best for the patient. Not what's best for you as the caregiver, but what's really best for the patient. And bringing everyone together and knocking down those silos. Although it was challenging, once we actually started to do it and we started to see the results, patients are waiting a lot less time in the emergency department. The ER waiting room is empty most of the time. We don't have all that backup there because no matter how well you care for a patient up on the floor, if they're waiting in the ER too long, they're not having a good patient experience. And also, we were delaying their testing. So I think the challenge was getting everybody to kind of speed up and make sure that they were doing what they needed to do for the patient rather than for the department.
And what's been some of the feedback that you've received from staff and nurses? I mean, you're very,
Yeah.
very passionate about supporting care in
Right.
all paradigms, but certainly a leader on the nurse executive level. What are some of the nurses? What are they telling you?
The nurses are very, very happy with it for a variety of reasons. One is they're not working in a vacuum anymore. They're there helping to coordinate that care, but number one, they're part of the SNAP huddle in the morning, so that allows them to understand what's actually happening for the patient. Through the care logistics software that we use, and you may have seen it already up on the unit, the boards that we use, that nurse now knows that her patient is going for a CAT scan at 10 o'clock. That was something that she never knew before. The schedule was there, but maybe it was changed at the last minute. So now if she knows her patient's leaving her unit at 9 o'clock, she can coordinate the care for the patient prior to them going and coming back, after they come back. So the nurse now has so much more knowledge that she can impart to the patient. She's not running around all day trying to find out when is the patient going down for a test, when is the patient going to the OR, where is the patient going after discharge, what's happening for that patient. So she actually has all the information she needs because, let's face it, the patient always asks the nurse, what's happening, what's going on. The nurse used to have to say, gee, I don't know, let me go find out. She'd go back, she'd come back. Now that nurse has all that information at her fingertips, and so she can not only coordinate the care, but her patient is a lot happier.
So much better situational awareness for the entire care team. And, you know,
Right.
we always say this, and you and I go back a long way. I've had the privilege to work with you on multiple different areas, and we're both very passionate about keeping the patient at the center of care.
Absolutely.
And always putting the patient first. How has this benefited the patient? Some of the outcomes.
Yes, so some of the really good outcomes are, number one, we try to we explain to the patient when they first come in, now we know what's their diagnosis and how long do we expect you to be here. So it's not a constant waiting game for the patient. I think that's a very important thing. The patient knows when their testing is going to happen. They work every single day with the patient to say where they're going after discharge. They can prepare, their families can prepare for them to either, if they're going home, to prepare for them to go home, or if they have to go somewhere else after discharge. So I think from the patient's perspective, that wait time for everything to happen has been cut down tremendously. They get to come in, they get their tests done, they get their results, they work with their physician, and then they get to go home. And I think that's really an important piece of, probably the main advantage for the patient today.
And I'll tell you, the physicians in the community are also very happy because they know that you've created additional capacity here
Absolutely.
at the medical center,
Right.
Which means their patients get in sooner, they get treated quicker. The care has always been outstanding here, but it's the efficiency piece that I think has been really incredibly well received by everybody. So I'd like to thank you for taking the time to speak with us today and sharing the incredible journey you're on here at Good Samaritan Hospital.
Thank you. Well, thank you for your support as always. Really appreciate it.
Thank you, Karen.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to CHS Presents Dr. O, Faithfully Transforming Healthcare. Good Samaritan Medical Center has been enhancing communication, creating a safer and more efficient environment for patients. Here to speak more about it is Dr. Donald Teplitz, Chief Medical Officer and Senior Vice President of Medical Affairs for Good Samaritan. Welcome, Dr. Teplitz.
Thank you.
So let's talk a little bit about the new process that was put in here from a physician perspective.
Sure.
Can you share a little bit of feedback you received from physicians? Had the new process been beneficial for them and for their patients?
Yes. We realized that we wanted to make improvements on the throughput and efficiency in the hospital. That went all the way down to the ED, admitting patients from the ED through different levels of care in the hospital. They wanted to make better coordination of care, and they wanted to make sure that the throughput and efficiency of their patients was exactly the way that it should be.
And so with their support, you think this is a sustainable model? And again, the benefit for them and their patients is there's room at the end, so to speak, right? Because the care here has always been wonderful.
Correct.
But it's really about creating the capacity and making sure that people do not have long dwell times in certain areas of care, especially the EDs.
Correct, and you're absolutely right. We want to make sure the throughput through the ED, when a patient comes into our institution, that the wait is not long, they get the appropriate care in the ED, and we make a decision whether they need further care in the hospital or they can be discharged from the hospital. In the standpoint from the length of stay, a patient, as the studies have shown, the longer a patient stays in the hospital, the chances of developing hospital-acquired conditions, hospital-acquired infections. So the physicians here at Good Samaritan clearly understand that, and what we're trying to do is make sure the care is more efficient here at the hospital. What we call it is reducing the white space, making sure that when a patient comes into the hospital, the care is efficient, the testing, the workups, everything is more efficient so the patient can get their care that they need and they can be appropriately discharged to wherever, either home or to another facility.
And it's really creating that, what I'll say is situational awareness between all the care team members and the patient. But I think what's really impressive about Good Samaritan's program here is that it's visible and it's communicated through your huddles as well.
Correct.
So everybody's on the same page. Has this had a positive impact on the quality of care?
Absolutely. What we always say, patients are the priority, excellence is our goal. We make sure patients and their families are communicated to. We also make sure the nurses, the managers of care coordination, and the physicians are always talking about the care of the patient on a daily basis. We have the SNAP huddles, we have escalation huddles, and then there is escalation with our physicians if need be. If I need to, or my associate chief medical officer needs to call a physician, just to see how the care is going, we will call the physicians as well. But there's always communication with the families. They know what day of care the patient is on, and they also know what the treatment plan is for that day. With our new software here, we actually can give a patient an agenda. In other words, they'll know from the nurses in the morning what exactly they're going to be doing, what to expect all day.
How about, what's been some of the feedback from patients? I mean, you're out and about, you're always visiting patients, you're checking on the level of care. What's some of the feedback you're getting from them?
Well, what I'm hearing from patients and the community is the facility has really, they've seen a significant change. When they come here to the ED, the long waits are no longer there. They're really not waiting in the waiting room.
Right, so really bringing them in quicker. Talk a little bit about the technology, because we talk people process, and you mentioned some of the technology, and we have some clips of that. And you like to call it, I hear, care traffic control.
Correct.
So talk a little bit about that and how that's helped.
Sure. So what that not only helps, it helps our care team, it helps the physicians, it also helps in our hub. You saw the hub. So basically everybody's coming together to really coordinate the care, understand what the length of stay should be, and when the discharge date should be, so the patient and their family know exactly when their loved one is going to be going home or to another facility.
It's really great work. Share with our viewers one more time your rally cry and relative to the pin you're wearing.
Sure. Our statement is, patients are the priority, excellence is our goal.
Wonderful. Dr. Teplitz, thank you so much for meeting with us today.
Sure. Thank you.
And now for my final thoughts for today. CHS has invested significantly to improve its quality of care at all of its sites. However, as you've seen today, we've also made significant investments to improve the efficiency and hence patient experience of care. You know, as I always say, it's really about delivering the right care in the right place at the right time by the right people. And that is what we're committed to here at CHS. And now for advice on how to triage your life. Today's topic, ovarian cancer, a potentially fatal disease. My goal is to bring you information that will help you live a healthier life. With so many experts, it's hard to determine what is factual and what is not. I want to share with you truth in medicine with no spin, no marketing, just the simple, unvarnished truth, as well as some trusted sites for information you can reference from home. I hope you'll find this material beneficial, and I wish you a healthier, happier life. This month's health tip and solution focuses on ovarian cancer. The one source of truth I'd like to share with you comes from the Centers for Disease Control and Prevention, or the CDC, at www.cdc.gov/cancer/ovarian. In 2015, the latest year for which incidence data are available, more than 21,000 new cases of ovarian cancers were reported, and close to 14,000 women died from it. This kind of cancer goes undetected because its symptoms are common to other, less deadly ailments, which is why women must be on the alert to seek treatment as quickly as possible. Risk factors include advancing age, a history of breast, ovarian, or colon cancer, and possibly even obesity. While there are more than 30 different kinds of ovarian cancer tumors originating from different types of cells, the three most common are epithelial, germ cell, and stromal. Ovarian cancer has 4 stages, from stage 1, in which the cancer is present only in the ovaries, to the most advanced and deadly stage, which is stage 4 disease, with the disease already having spread to other organs such as the liver or lungs. The CDC indicates that women diagnosed with ovarian cancer have reported vaginal bleeding, particularly when past menopause, bloating, pelvic or abdominal pain, a change in bowel habits, fatigue, and back pain. However, these symptoms persist longer than 2 weeks despite being addressed through what would be called conventional interventions, such as a change in diet or better rest. I urge you to see your primary care physician to have these evaluated. Unfortunately, such signs only become noticeable when the disease is advanced. It is important to note that although the Pap test is used to screen for cervical cancer, it does not detect ovarian cancer, making it vital that women recognize and act upon those warning signs I shared with you earlier. If a woman should test positive through any of the available screening procedures, a gynecologic oncologist would be consulted to conduct a definitive diagnosis, normally with a biopsy. The leading treatment for ovarian cancer is surgical removal of the cancerous tumor, often in combination with chemotherapy and, in rare circumstances, radiation. If you need a physician, please visit www.chsli.org or call 1-855-CHS-4500. For more health information, tune into CHS Presents Dr. O, Faithfully Transforming Healthcare, airing on the Catholic Faith Network and CBS TV 55. To view recent episodes, go to CHS's YouTube channel, where you can also watch Dr. O's Triage Your Life. If you'd like to know more about Good Samaritan Hospital Medical Center, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows, please email us at dro@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Dr. O, Faithfully Transforming Healthcare.